Hello, welcome to Chapter 12, the endocrine system. So we're going to go through all of the different terms that deal with the endocrine system. We're going to look at all the different organs of the endocrine system. We're going to look at abbreviations that deal with the endocrine system. Again, all these different organs, some of their hormones that they are secreted through the endocrine system. So let's start with the different endocrine organs that are found specifically in the brain and the endocrine system just in general. So the main endocrine organs of the brain are going to consist of the hypothalamus, which is the master, the master area of the entire endocrine system. We have the pituitary gland just below that hypothalamus, and then we have the pineal gland. In addition to the major organs of the endocrine system, there are also endocrine cells found in tissues all over the body. Endocrine cells and organs are going to secrete hormones. Those hormones will only have an effect on their target cells that have that specific receptor that those hormones can bind to. So these are the main endocrine organs outside of the brain. So we have the thyroid gland. This is in your neck. This sits just below that thyroid cartilage. You should not be able to feel this unless you have an enlarged thyroid, which usually sometimes signifies thyroid problems. On the back side of the thyroid gland, we have the parathyroid glands. They sit on both sides on the back because that thyroid gland is kind of a butterfly shape that wraps around the trachea. The thymus. This was the organ from that immune system. Sits up on top of the heart. We have adrenal glands. These sit on top of the kidneys. Pancreas. This is an endocrine and an exocrine organ because it secretes out insulin, glucagon, which are hormones, but it also secretes out digestive juices. And then we have the gonads, which are the ovaries in the females and testes in the male. So cells of the upper GI tract will secrete out hormones that include gastrin, which stimulates gastric secretions from that stomach. Cells in the kidneys are going to secrete out erythropoietin. Erythropoietin stimulates erythrocyte production, those red blood cells. Fat cells secrete out leptin. Leptin is supposed to help suppress appetite. A lack of leptin can actually lead to overeating and obesity. We also have prostaglandins. Cells and tissues throughout the body are going to secrete out these prostaglandins, and they're going to act locally to dilate blood vessels, relax airways, stimulate uterine contractions and menstrual cramps or labor, and lower the acid secretion in the stomach. When tissues are injured, prostaglandins are going to promote this inflammatory type of response. So let's start with the hypothalamus. Technically, the hypothalamus does secrete out or produce 8 different hormones. 6 of them they will secrete out themselves. That hypothalamus will secrete out. And those 6 actually go to the anterior pituitary gland, which causes that anterior pituitary gland to secrete out their own hormones. The other 2 hormones that are produced in the hypothalamus are going to travel to the posterior pituitary gland. So this pituitary gland kind of hangs down. It's separated off into an anterior and a posterior portion. That posterior portion, these hormones are going to travel down on nerves into that posterior pituitary, that oxytocin, and that antidiuretic hormone. Those will get secreted out from that posterior pituitary, but they're stored in that posterior pituitary until they are needed. Oxytocin can produce feelings of warmth and bonding, and its production increases in sexual intercourse. Antidiuretic hormone reduces the volume of urine produced by the kidneys. Then the pineal gland. The pineal gland is going to secrete out serotonin by day and converts it to melatonin at night. Serotonin is considered a neurotransmitter in both the central and peripheral nervous systems. Kind of one of those feel-good kind of neurotransmitters. Melatonin maintains that circadian rhythm, that sleep-wake cycle. The pineal gland reaches its maximum size in childhood and may regulate the timing of puberty as well. So endocrine means secrete within. So endocrine glands are glands that produce an internal secretion, specifically into the bloodstream. Endocrinology is the study of the endocrine system. A hormone literally means to set in motion. Hormonal is that adjective form that means pertaining to hormones. Hormones are those internal secretions produced by the endocrine structures that act on the functions of another tissue or organ. Melatonin, oxytocin, serotonin are hormones. Serotonin and melatonin are produced by that pineal gland. Oxytocin is produced by the in the hypothalamus, traveled to the posterior pituitary gland where it gets secreted out and stored until it is needed. So the pituitary gland has that anterior and that posterior side that I've been talking about. I drew that picture a couple slides ago. The anterior side secretes out a lot of hormones. We've got follicle stimulating hormone, which stimulates the ovaries to develop ova and stimulate the testes to produce spermatozoa, so those reproductive cells specifically. Luteinizing hormone stimulates ovulation in females and stimulates the testes to produce testosterone. Thyroid stimulating hormone does exactly what it says. It stimulates the thyroid gland to produce that thyroid hormone, thyroxine. Adrenocorticotropic hormone, ACTH, stimulates the adrenal glands to produce corticosteroids, one of their many hormones. Prolactin stimulates the mammary glands to produce milk in the breast. And then growth hormone. Growth hormone stimulates cells to increase in number and in size. So in childhood, growth hormone stimulates children, teens to grow. In adulthood, it stimulates cells to grow, to reproduce. So increase in number of cells, so it's keeping our cells reproducing. Then that posterior pituitary. that oxytocin stimulates uterine contractions, and it also does lactation. So we said up here prolactin causes those mammary glands to produce milk. Oxytocin causes that milk to be ejected from the breast. And then that anti-diuretic hormone regulates the urine production by the kidney. So it's causing us to retain more water. So ADH, anti-diuretic hormone, produced by that hypothalamus. That anti-diuretic hormone decreases urine production. It's produced by that hypothalamus, but it's released by the posterior pituitary. Sad. Seasonal affective disorder. It may be linked to serotonin production by the pineal gland. These are people that feel more sad and depressed in the winter months because there's not as much sunshine out. Diabetes insipidus. This has to do with an inadequate production of antidiuretic hormone, which means people are losing too much fluids. OT, oxytocin, and PRL is that prolactin. ACTH, that adrenocorticotropic hormone. Nice thing is this one tells you where it's going. Adrenal glands, cortico, the cortex. So it's going to the cortex of the adrenal glands. FSH is that follicle stimulating hormone. GH, growth hormone. LH is luteinizing hormone. And then TSH is that thyroid stimulating hormone. All of these hormones listed here come from the anterior pituitary. So what happens if we have too much growth hormone, that overproduction? Well, in a child, before their bones are done growing, it can cause giantism, where that person can grow up to be over 7 feet tall. Puberty may be late onset, that genitalia may not fully be developed either. And diabetes may be a problem later on in life. In an adult, it causes acromegaly, where they get this enlarged protruding mandible because some of your bones are still going to continue to grow after you become an adult, like your mandible will, your jaw. You can have this grooved kind of tongue. You have enlarged hands and feet. You have more coarse, thick body hair and an increase in perspiration. What happens if we don't have enough growth hormone? This is what is caused or called pituitary dwarfism. These people are usually under 4'9", I think it is kind of that drop off of where it's at. So they have a very short stature. And then if there's not enough antidiuretic hormone, it's going to cause diabetes insipidus. It's that hyposecretion, so not enough, that antidiuretic hormone. So there's excess urine production, excessive thirst because you're losing so much water. These people usually have to take a synthetic form of this antidiuretic hormone. So dwarfism versus giantism. Dwarfism is caused by underproduction of that growth hormone, while giantism is that overproduction of growth hormone. Acromegaly is that overproduction of growth hormone in an adult. Giantism is in a child, that overproduction of growth hormone before the growth plates and the bones close. So, pituitary diagnostic procedures, a visual fields test, can actually show the presence of a pituitary tumor, as this tumor will press on the optic chiasma, which is part of that optic tract, the pathway those nerves coming from your eyes goes to. Pushing down on this optic tract can cause a loss of vision, and that peripheral visual field especially. Blood and or urine tests can measure the level of pituitary hormones to show the presence of hormone-producing pituitary adenomas. So again, another growth of that pituitary gland. An MRI, magnetic resonance imaging, can show pituitary tumors that are greater than 3 millimeters. And then that biopsy is when they go in and take that tumor to make a firm diagnosis, to make sure that they're diagnosing it correctly. So when pituitary tumors are removed, they are always examined under a microscope to confirm that exact diagnosis. Adenoma, we have the root of aden, which is going to mean plant. Biopsy has that root word of bio, which means life. Optic has that root of opt, which means vision. Osmolality has that root of osmol, which means concentration. So different pituitary therapeutic procedures. That surgical removal of the pituitary tumor is necessary if that tumor is pressing on that optic nerve, so causing vision problems, or if it is overproducing hormones. Some of the different procedures, we have endoscopic, transnasal, transsphenoidal approach. So that surgery is performed through the nose and through the sphenoid sinus using an endoscope. A craniectomy is when a very large tumor is removed through the upper part of the skull. Then image-guided stereotactic surgery uses computers to create a three-dimensional image of the tumor to guide the surgeon during that craniectomy. Radiation therapy can be used alone after surgery or if the tumor persists or returns after surgery. So we have gamma knife stereotactic radiosurgery, which delivers a single high-dose radiation beam the size and shape of the tumor using special brain imaging techniques. Proton beam therapy delivers positively charged ions, those protons, rather than X-rays in beams that are finely controlled with minimal risk to surrounding healthy tissues. External beam radiation uses X-rays in small increments about 5 times a week over a 4 to 6 week period that may damage surrounding healthy pituitary and brain tissues. Craniotomy means incision of the skull. Endoscopic, pertaining to an endoscope, it's an instrument that is used inside of a tubular or hollow organ, so a little camera that's being sent down. Stereotactic means pertaining to a precise three-dimensional method to locate a lesion or a tumor. Transsphenoid means through the sphenoid sinus. So let's start moving our way down. We've went through the head. Let's keep moving down. So the thyroid. As I mentioned, here's that thyroid cartilage, that Adam's apple in a male, that thyroid gland that sits just below it. That thyroid gland, it's about 2 inches across and it's shaped in like a bow tie or a butterfly, whatever you choose. The cells in that gland are going to secrete thyroid hormone, known as T3 and T4. The term thyroid hormone refers to T3 and T4 collectively. The thyroid does produce another hormone, calcitonin, which promotes calcium deposits and bone formation. So it promotes that calcium to be stored in those bones by forming new bone. The parathyroid glands, which are located on this posterior side, on this back portion of both of here. This parathyroid gland secretes parathyroid hormone, which raises blood calcium levels. So this one will raise calcium levels in the blood by reabsorbing or breaking down our bones. Calcitonin lowers calcium blood levels. So these two work opposite of each other. Calcitonin, parathyroid hormone. People tend to confuse those two. Parathyroid hormone and calcitonin, because they work opposite of each other, are known as antagonists. They are antagonistic, so they do opposite effects. The thymus gland. That thymus gland is in that mediastinum, kind of sits on top of the heart. It's the largest in a child, and then it's going to start to atrophy or get smaller as you get older. The thymus gland is going to secrete a group of hormones that particularly stimulate the production of lymphocytes. So T3. T3 stands for thyroid hormone triiodothyronine. That tri means 3. That's where that 3 comes from. T4 is that thyroid hormone tetraiodo-thyronine or thyroxine. Tetra means 4. PTH is that parathyroid hormone. And versus, abbreviation for vital signs. So temperature, pulse, respiration, and blood pressure. Let's deconstruct some words. Emacitation. The root and combining form is amasa, which means thin. Ation, this is going to mean process. So abnormal thinness. And it usually results from hyperthyroidism. So too much thyroid hormone. That thyroid hormone maintains your metabolism, your cell's metabolism. Too much of it speeds up that metabolism. Calcitonin. So calci is that root combining form that means calcium. Then we have the root ton, which means tension or pressure. And then we have the suffix in, which means substance. So calcitonin is the thyroid hormone that moves calcium from blood to bones. Antagonist. Prefix ant, which is going to mean against. Then we have the root, agon, which means fight, ist, agent. So an antagonistic is an opposing structure, agent, disease, or process. So these different disorders, I mentioned hyperthyroidism is that excessive production of thyroid hormone that causes people to be excessively skinny because that thyroid hormone helps to maintain your cell's metabolism. Graves' disease is the autoimmune for hyperthyroidism. They usually have a goiter, which is kind of like this lump, enlargement of the thyroid gland. This lump is what you'd see in their neck. An exophthalmos, which is where their eyes kind of protrude out. This is a very characteristic sign of hyperthyroidism is that exophthalmos, that those eyes bulging out of their head, their face. Hypothyroidism, on the other hand, is not enough production of that thyroid hormone because that hypo means that below that normal range. Severe hypothyroidism is known as myxedema. The signs of hypothyroidism is going to be that dry, scaly skin, maybe that puffy face and eyes, loss of hair. They may also have a goiter. Here's the interesting thing is you can have a goiter for hyperthyroid, too much thyroid, hypo, not enough, or normal function. Hypothyroid is going to have weight gain because their metabolism is slowed down in their cells. Constipation, because again, that metabolism is slowing down that digestive tract. Slow, it may be slow just because they can have brain fog, massive brain fog. They can have a hoarse voice and this inability to tolerate cold. That is very true. Thyroiditis is that itis is that inflammation. So that thyroiditis is inflammation of that thyroid gland. Hashimoto's disease is that autoimmune disorder for hypothyroid. These people, hypothyroidism, myxedema, and Hashimoto's require hormone replacement therapy. So they have to take thyroid hormone to replace what they do not have. Creatinism is a thyroid deficiency that is inborn, means it's from birth. And what it does is it these children usually end up with severe mental retardation and physical growth. And then thyroid cancer. The first sign of thyroid cancer is usually a symptomless nodule in the thyroid gland. So somebody whose neck is like kind of skinnier, you can see that nodule in their neck. And it's often related to an irradiation in childhood and adolescence for conditions such as severe acne. So hypothyroidism versus hyperthyroidism. Well, that hypo means it's below normal. It's deficient production of that thyroid hormone versus that hyper, which means it's above normal thyroid hormone production. A goiter, exophthalmos, and Graves' disease all occur in hyperthyroidism. So that goiter is that enlarged thyroid gland. Exophthalmos is those protruding eyeballs. And they are symptoms of Graves' disease. A thyroidectomy is a removal of that thyroid gland. Sometimes that is the only way to treat hyperthyroidism or Graves' disease. They actually have medications that will kill your thyroid gland. Then it puts you into hypothyroid. But thyroiditis is that inflammation of that thyroid gland versus thyrotoxicosis, which is excessive thyroid hormone production, just another term for it. So how do we diagnose thyroid disorders? Blood tests. They're going to usually measure that thyroid stimulating hormone, that TSH levels. Those levels can be off because that thyroid stimulating hormone, it's what your brain thinks your levels are at. What your hypothalamus and that pituitary gland thinks your thyroid levels are at, because that thyroid stimulating hormone is supposed to stimulate the thyroid gland to secrete out that hormone. So if that thyroid stimulating hormone is high, it can mean your thyroid gland's not secreting enough. If that thyroid stimulating hormone is very low, it means your thyroid gland is secreting out a lot of that hormone. We can also use the blood test to measure antibody levels, because if somebody has Hashimoto's or Graves' disease, they're going to have antibodies specific to the thyroid gland. If the serum calcitonin is elevated, it could mean medullary carcinoma. Isotopic thyroid scan. It's kind of this detailed scan of the nature of the thyroid enlargement and the function of the gland by needle aspiration biopsy, where they stick a needle into that thyroid gland into nodules to determine if it's benign versus malignant. And then ultrasonography is doing that ultrasound that looks at your thyroid gland in the presence of nodules. So they can do radioactive iodine therapy, which uses isotopes of iodine that emits radiation to treat hyperthyroidism. This is what I was talking about, where they go in and this radioactive iodine will go in and pretty much kill off your thyroid gland. It kills your thyroid gland and throws you into hypothyroidism for the rest of your life. They can do surgery. Surgery may be indicated for cancerous and benign nodules, goiters, overactive thyroid glands. And there's different types. We have excisional biopsy, which is the removal of a small part of the gland. Lobectomy, which is going to remove half of that thyroid gland. We have a thyroidectomy, which removes all of that thyroid tissue. And then a laser ablation, which is the removal of a benign nodule using ultrasonic or ultrasound guidance. Adrenal glands. So those adrenal glands sit on top of your kidneys. So you'll have two of them. As long as you have two kidneys, you have two adrenal glands. That is known for sure. The adrenal glands can be thought of as two glands. We have the adrenal cortex and we have the adrenal medulla. They secrete out different hormones. Like the adrenal cortex is going to secrete out corticosteroids, which are glucocorticoids, mineralocorticoids, and sex steroids. And then that adrenal medulla is going to produce catecholamines, which are responsible for that fight or flight response in stressful situations. So our corticosteroids, our glucocorticoids are going to regulate the use of fats and protein as energy and regulate blood glucose levels. Mineralocorticoids regulate electrolytes, specifically sodium is the main one. And then those sex steroids is that estradiol and androgens. So those estrogens and testosterones. Females, this is where we get testosterone from. This is also where we get our estrogens from post-menopause. Catecholamines, that epinephrine and norepinephrine, or adrenaline and noradrenaline. They prepare the body for physical activities. Addison of glucocorticoids by the adrenal cortex. Signs and symptoms of Cushing's include obesity of the trunk, muscle wasting and weakness, osteoporosis, kidney stones, and an increased susceptibility to infection. So let's look at the suffix of these words. Adrenal cortical. All is that suffix that means pertaining to. So adrenal cortical means pertaining to the cortex of the adrenal gland. Aldosterone. One meaning hormone. Aldosterone is that mineralocorticoid of the adrenal cortex. Corticosteroid. OID meaning resembling. So this is the corticosteroid is a hormone produced by the adrenal cortex. Then we have epinephrine or norepinephrine, same suffix of "ine," which means pertaining to again. So that norepinephrine is one of the catecholamines produced by the adrenal medulla. It is also known as that noradrenaline. Facies means facial expression and facial features. Catecholamine is the major element in the stress response. So they respond, or they include that epinephrine and norepinephrine. That norepinephrine is a catecholamine hormone of the adrenal medulla, the middle portion. That is a parasympathetic neurotransmitter. On to the pancreas. The pancreas is located in the abdominal cavity near this duodenum here, the first part of that small intestine. most of the pancreas is an exocrine gland secreting digestive juices. Through a duct, these pancreatic ducts here, scattered throughout the pancreas are clusters of endocrine cells. So here, these are pancreatic isolates, also known as these endocrine cells, and they're usually surrounded by blood vessels. The endocrine cells are going to secrete out glucagon, insulin, and somatostatin. Glucagon is going to raise your blood glucose. Insulin will lower your blood glucose, and somatostatin inhibits the secretion of both glucagon and insulin. So glucose. Glucose is the simplest carbohydrate or sugar. Gluc means sugar or glucose, and the suffix of "-ose" means full of. Glucagon is that pancreatic hormone that raises blood glucose levels. The root, again, gluc, means sugar or glucose. Gon, that suffix, means to fight. Gluconeogenesis is the formation of glucose from non-carbohydrate sources. So we can make glucose from fats. We can make glucose from proteins through the process of gluconeogenesis. So we have the combining form, gluco, meaning sugar, glucose. We have a prefix in here, neo, means new. And that suffix, genesis, means creation. So we're creating glucose from new sources. Glycogenolysis is the conversion of stored glycogen to glucose. So we have that root in combining form, glyco, again, glucose. Another combining form, geno, means create. Lysis means to separate or dissolve. So glycogenolysis, glycogen, geno, new, creating new. Lysis, we're creating glucose by breaking down glycogen. So how are these terms related? Glucagon, insulin, somatostatin, pancreas, and isolates of Langerhans. Well, the isolates of Langerhans are found in the pancreas. This here, pancreatic isolate, is one of those isolates of Langerhans. Those isolates of Langerhans in that pancreas contain alpha cells, which produce glucagon, beta cells, which produce the insulin, and delta cells, which produce that somatostatin. So it relates, the pancreas contains these isolates of Langerhans, which contain cells, alpha cells for glucagon, insulin is the beta cells, delta cells are the somatostatin. So diabetes mellitus is characterized by hyperglycemia, too much glucose, resulting from impaired or absent insulin producing and secretion. Diabetes has 4 major categories. Type 1, this is insulin dependent. Diabetes mellitus, because It's autoimmune, so their immune system is killing the cells that make insulin. So it's killing those beta cells. So they need to rely on insulin because their body cannot make it. Type 2 diabetes or non-insulin dependent. Oh, it is E. E. Non-insulin dependent. This is because of an impairment of insulin effectiveness and response. Those beta cells may have been overworked, so they're not producing as much insulin. Insulin does not have an effect on the cells that it's trying to take that glucose from the bloodstream and take it into the cells like it should. We have gestational diabetes. Gestational is during pregnancy. Sometimes just during pregnancy, that blood sugar skyrockets, it goes up. And that's what causes gestational diabetes, which is GDM. Mature onset diabetes of the young. This occurs in the teens and 20s. Type 1 diabetes is usually diagnosed in the teens. Type 2 diabetes is 40s plus. I mean, it can be higher or it could be younger, but that's just a general average age. So DM, diabetes mellitus. IDDM is that insulin dependent diabetes mellitus. This is mature onset diabetes of the young. And then we have NIDDM, non-insulin dependent diabetes mellitus. And then GDM is that gestational diabetes mellitus. Hypoglycemia. And hypo means below normal. So this is where there's a decreased blood glucose level. Symptomatic hypoglycemia can sometimes be called insulin shock. So there's signs can be like different signs of insulin shock or hypoglycemia is that shakiness, anxiety, confusion, because your brain uses glucose to make energy. It's the only form of energy that your brain can use. Hypoglycemia can lead to a coma. Treatment for hypoglycemia is usually the administration of a beverage that has high glucose levels or fructose content, another type of sugar. 3 to 4 ounces of fruit juice will improve symptoms of hypoglycemia. It doesn't take much. Hyperglycemia, on the other hand, is that increased, because hyper means above normal. So we have that increased blood glucose level. Signs and symptoms of hyperglycemia: polydipsia, polyphagia, polyuria. A lot of urinating, polyphagia, polydipsia, polyuria. So hyperglycemia can be asymptomatic, but hyperglycemia damages the cells of the retina, your nerves, and your kidneys having too much glucose. Diabetic ketoacidosis is seen most frequently in type 1 diabetics and can actually progress to a diabetic coma. And that diabetic coma is a life-threatening emergency. So here's these terms. Polydipsia is that excessive thirst. Polyphagia is excessive eating or hunger. Polyuria is that excessive urination. Because poly means many. That's that prefix for many. And then that IA is that suffix for condition. And then our root word, it tells us where. Dips, thirst, phage, hunger, eating, for uria, urination. So how do we treat it? Type 2 diabetes specifically can be treated with diet and exercise. This will not work for type 1. This will only work for non-insulin dependent diabetes, so that type 2. Maintaining a normal weight can help lower that diabetes. Patient education. They need to understand the disease and recognize the significance of symptoms and signs. A lot of people, especially with type 2 diabetes, don't necessarily understand their condition and what can happen if they don't manage their blood glucose levels. I've come across patients who, as they've put it, all hell broke loose. Like 6 months ago, I had one patient tell me that, but it was all built up signs from uncontrolled type 2 diabetes. So was either he wasn't educated or he just never listened when he was educated. Works both ways. Glucose, plasma glucose monitoring is to maintain blood glucose within normal limits at all times. An assessment of the patient on routine physical or physician's assistant or visits. Then periodic laboratory evaluation. So they need to monitor that plasma glucose control over that preceding 3 months. Hemoglobin A1C is hemoglobin A1C is going to tell us hemoglobin HB, and that A1C is what's telling us what that glucose levels were over the last 3 months. So a ketone is a chemical found in uncontrolled diabetes or in starvation. So it's important to talk to your patients or talk to when they see ketones to talk to them to see, are they doing fasting and how long? Ketosis is the excessive production of ketones. Ketoacidosis occurs when excessive ketones in the blood make it acidic, like diabetic ketoacidosis. This is a state of hyperglycemia with dehydration, metabolic acidosis, and ketone formation. Acetone is a ketone that is found in the blood, urine, and breath when diabetes mellitus is out of control. This acetone can actually cause urine to have like a fruity type of smell to it. That is actually a sign of diabetes, urine having a fruity smell. Metabolic acidosis is that decreased pH in blood and body tissues as a result of an upset in metabolism and a sign of diabetic ketoacidosis. So BUN is this blood urea, nitrogen, which is a test to determine your kidney function, DKA, diabetic, ketoacidosis, and that hemoglobin A1C, glycosylated hemoglobin, which is that test that monitors your blood glucose for up to 3 months. So this endocrine system works through the use of hormones to help regulate your body's homeostasis, that nice balance. Hormones are produced by these different glands, secreted out into the bloodstream, and they go to their specific target organs. If you have any questions on any of this material, please feel free to ask. Otherwise, have a wonderful day. Thank you. Bye.